Hi everyone, my name is Melody Sarami, and my group and I will be presenting on HPV and oral cancer. It can bite anyone. To start off, here's a slide that discusses what this presentation will go over. We are going to start off talking about HPV, then oral cancer, then examining the correlation between the two. And then following that, we will go over scientific investigations, treatment options, which we will actually further discuss in the presentation because it is in fact a little nuanced, and lastly, some recommendations. So let's begin by discussing a little bit about human papillomavirus, which is commonly known as HPV. So now on to a brief overview on HPV. HPV is a very common sexually transmitted infection, and in fact, it is the most common nationwide. Here lists the modes of transmission: vaginal, anal, oral sex, and anyone who partakes in sexual activity can potentially contract HPV. And one important thing to remember is that this STI can be spread whether or not a person is symptomatic, and in fact, many are usually asymptomatic, which is contributing to the high transmission rate in the United States currently. Here shows the statistic from the CDC indicating how prevalent this STI is. Approximately 79 million Americans deal with HPV, and a great majority of this cohort is largely comprised of teens and young adults. Okay, so HPV can actually be categorized into two groups, low risk and high risk. I'm going to be talking a little bit about both, but we'll primarily be focused on high risk HPV. So low risk HPV, many know this as the wart causing one, and then high risk, many know it as the cancer causing one. So that is in fact true. Low risk presents signs and symptoms, typically warts, and these can be found in the genital area or anus. And then high risk is cancer causing, and it rarely actually presents signs and symptoms, which is problematic because this is the very serious one, which can potentially lead to cancer. And this is the one that is in fact asymptomatic, and most people don't even know that they have it. Okay, so on this slide, we can see signs and symptoms of low-risk HPV. So as you can see, these are visual. It ranges from flat warts, common warts, and plantar warts. So here we have more signs and symptoms of low-risk HPV in the genital region, and as you can see through the pictures, these are again visual. So now moving on to low-risk HPV testing. Obviously, since this is visible, it can be done easily through a visual examination. However, when we go to high-risk testing, it becomes a little more complicated to diagnose. So high-risk testing is evidently more complex. There are two different types of tests, including of an HPV test and a Pap test. So a Pap test, also known as a Pap smear, is a routine test that women begin getting annually, beginning at the age of around 21. This looks at any abnormal cells or changes in the cervix. As you can see on the left of the Pap test, we have the HPV test, and the HPV test solely scans for that virus, so no cell changes. And many of you guys are probably curious about male testing. However, there's still no HPV test for men yet, which makes it quite feasible for men to unknowingly transmit this infection. So here's a representation of a Pap test. So as you can see, the speculum is being inserted into the vagina, and then a brush is going in to collect a sample of cells from the cervix. And that's basically how you test for high-risk HPV.
Hi everyone, my name is Rachel Korshad and I am going to introduce oral cancer during this presentation. In general, cancer is defined as the uncontrollable growth of cells that invade and cause damage to surrounding tissues. Oral cancer, specifically, includes cancers of the lip, tongue, cheeks, the floor of the mouth, hard and soft palates, your sinuses, and the pharynx. Oral cancer appears as a growth or sore in the mouth that does not go away. Some risk factors of oral cancer include smoking, excessive consumption of alcohol, a family history of cancer, excessive sun exposure, or HPV, which is something that we will zoom in on later in the presentation. As you can see on this slide, there are a number of symptoms of oral cancer that are listed. A few that I would just like to mention include unexplained bleeding in the mouth, numbness, pain, tenderness, or numbness in the face, mouth, or neck, difficulty chewing or swallowing, and persistent sores that bleed easily and do not heal. In this slide, we are able to see what a patient undergoes if he or she has an oral cancer screening. As we can see, the physician will check all areas of the mouth, including the tonsillar area, the ventral surface of the tongue, and the hard palate, just to list a few.
My name is Natalie Sarami, and I'm going to be talking about the correlation between HPV and oral cancer. So in understanding the correlation between both HPV and oral cancer, it is equally as important to be able to distinguish between the types of HPV and which particular types are cancer-causing. So HPV is grouped into two separate groups. The high-risk HPV is the first one. This encapsulates the strains of HPV that are cancer-causing. So some examples include HPV 16 and 18. But in regards to oral cancers, the most disconcerting is HPV 16. And then the other group of HPV is the low risk, and this type is typically characterized by genital warts and not likely to contribute to the individual developing cancer. So also at the bottom of the slide, you could see more males than females will develop oropharyngeal cancers. So men are clearly disproportionately affected, and then white non-smoking males from the ages of 35 to 55 are most at risk.
Hi, I'm Chaitra Subbarao, and I'm going to be going over some of the key studies we found on the correlation between HPV and oral cancer in our literature review. So this is a graph that was published in a study in the Journal of Dental Research in 2014, and it's outlining the trends that have been observed in oral cancer cases over the past few decades in the USA and in Sweden. So this includes both HPV positive cases and HPV negative cases. So if you look at the orange line, that is the overall oral cancer case incidence, and there has been a steady increase in the past few decades in both the US and Sweden. But if you look at it based on its HPV association, there's a decline in the HPV negative cases, but a pretty steep increase in the HPV positive cases. This first study was published in the Journal of the National Cancer Institute in 2000, and it was really the initial study that explored that potential correlation between HPV and oral cancer. So the background information that this study was based on was that a potential correlation was observed in the late 90s, so not too long before this study was done, and also that oral cancers were seen in some non-smokers and non-drinkers. And additionally, high-risk HPV strains were known to cause tumors in epithelial tissue, so this was kind of their basis for proceeding with the study. So 253 patients were recruited for the study, and these patients had either recurring or newly diagnosed head and neck cancer. And the data that they collected on these patients was the age that they were diagnosed, any alcohol or tobacco exposure, and information about the tumor. So where the tumor was located, if there was HPV DNA found in the tumor, and the stage of the tumor. So after collecting all this data, they found that 84 of the 253 patients, or 33%, had an oral cavity tumor. And of those that had that oral cavity tumor, there was HPV DNA found in 23%. And upon further investigation, they found that 89%, so a majority, had HPV 16, which is a high-risk strain. and the most common tumor locations were the oropharynx, the oral cavity, and the larynx. So the results from this study definitely supported the data that it was based on and encouraged further investigation into the correlation. The second key study we looked at was published in the International Journal of Cancer in 2004. And this study aimed to identify any differences in the tumors and risk factors between HPV positive and HPV negative cases. So 193 patients were included in this study, and these patients had either oral cavity cancer or oropharyngeal cancer. And the data collected on these patients came from a risk factor questionnaire, which included medical history, sexual practices, tobacco and alcohol use or exposure, and where the tumor was located. Additionally, they collected cells from the patient's mouths to analyze them. So after analyzing these results, they found that 20% of the sample was found to have high-risk HPV strains, including HPV 16, 18, and 33. But HPV 16 specifically was found in 92% of the oropharynx cancers and 77% of the oral cavity cancers. So a significant amount of these cases had HPV 16 DNA in the tumors. So as far as location of these tumors, the base of the tongue and tonsils were the most common location for the HPV-related cases, and some risk factors that they found were consistent among the HPV-positive cases were age, number of sexual partners, and sexual behaviors. So this study really kind of set a guideline for things that we can look out for in distinguishing HPV positive and HPV negative cases.
Hello everyone, this is Rachel Korshad again. In these next few slides, I would like to discuss some treatment and preventative methods. As you can see, there is a list of HPV preventative methods that people are recommended to practice. The most common and most popular of all of them is getting the HPV vaccine, but we have also highlighted that the use of condoms and dental dams are also recommended. Regular pap smear tests for females are recommended as well. If someone has genital warts, it is recommended that they avoid sexual activities in order to prevent HPV. Ultimately, the most effective out of all HPV preventative methods is the practice of abstinence.
So the HPV vaccine, also known as Gardasil, is a vaccine that targets the HPV types that typically cause cervical cancer, so we kind of talked about those, and it also prevents against the types that cause genital warts, so low risk, but mostly high risk, and this is a vaccine that comes in 3 separate doses, so you have to follow the specific recommendations by your physician, and it's open on the market for both men and women. So it's really important to get the vaccine as a primary prevention method. So just to close off with some recommendations, one, it can be advantageous to expand on the patient noncompliance aspect of the vaccine, as it can be difficult to monitor patient retention perfectly. Since the vaccine is a 3-dose vaccine, which we've kind of touched upon, with specific intervals of time in between each, some are unaware that the entire series must be done to reach full effectiveness, and that could be life-threatening. Another would be to raise awareness about the relationship between human papillomavirus and oral cancer and the misconceptions. Essentially, it's not the virus that can directly cause the cancers, but rather the fact that when an individual has HPV, he or she does not monitor it. If that happens, then it can lead to cancers. So more specifically, the virus itself can make normal cancers turn into precancerous cells, and then the precancerous cells, when they're not taken care of by a physician, will then multiply, becoming malignant. Here are the references. Thank you guys for listening to our presentation.